Nebraska has seen hospitalization rates and COVID cases skyrocket, and Ricketts is responding with a few more rules. But infectious disease experts say it's not enough. 3 News Now reporter Ruta Olsenitis spoke with leading UNMC infectious disease expert Dr. Lawler and has everything you need to know about the new DHM.
Last week, Douglas County recorded its highest number of new COVID cases, over 3,000. Almost 30% of tests last week were positive. Hospitals are nearing capacity with no sign of slowing down. And experts say this has now become extremely dangerous territory.
In 3 weeks' time, our hospitals will be overwhelmed, and we will no longer be able to deliver optimal and effective care for COVID. And we will also no longer be able to deliver appropriate care for everyone who comes in with a heart attack or a stroke.
The Omaha Metro Healthcare Coalition reports hundreds of hospitalizations in the area. Around 800 people are hospitalized all across Nebraska.
Okay, 800 people in the hospital. 6 weeks ago, that number was 200. So we're seeing rapidly rising hospitalizations. We need everybody's help.
On Monday, Governor Ricketts announced new restrictions on the directed health measures. Key changes include social distancing requirements in places of worship, something many churches, like Metropolitan Community Church in Omaha, already had in place.
When they said no restrictions, just go back, and our thought was, no, that's not safe enough for what we want to do.
Another change includes limits on indoor gatherings, not including bars and restaurants, from 50% to 25%.
Going from 50 to 25, on the theater side, to be quite honest, it doesn't really affect things.
Governor Ricketts says he'll see how the community is impacted with this new, stricter directed health measure and make adjustments from there. But infectious disease experts are saying that'll be too late.
Unfortunately, those DHMs that were announced today are grossly insufficient to slow down transmission rates in the community. And those are not going to dramatically deflect the curve.
Bars and restaurants can remain at full capacity with 6 feet required between tables. Infectious disease expert Dr. Lawler says that's where most of the change needs to happen.
Restaurants and bars and clubs are clearly epicenters for large transmission events.
Dr. Lawler says this week will be vital to the fate of the healthcare systems in Nebraska. If cases can dramatically decrease, the rest of the winter months should be okay. Reporting in Omaha, Ruta Olsenitis, 3 News Now.
Other changes in the DHM include limits on fan attendance or youth, school, or club sports to families only. Mask requirements are now in place in businesses with 15 or more people. For a full list on all the changes that go into effect on Wednesday, visit our website at 3newsnow.com.